Hello everybody, I'm Dr. Valeria Soltanik and I'm going to go over patients' x-rays to explain a little bit more about the cases and what do we find on an oral exam. So here we have a patient. So before anything, on an x-ray, here we have the right side and here we have the left side. In this patient, what do we see? This is a panoramic x-ray. We see that the patient is missing 2 teeth on the bottom. And what else strikes us is this abscess here. This tooth on the bottom left has a very large circle area, dark, and that is an abscess. It's an area of infection. And why did this happen? In this case, in this patient, we see that he has generalized bone loss. So the bone level is lower, so he has lost a lot of bone. And this tooth also, it's broken. And the break is on top of the nerve, thus the decay or the break on this tooth plus the bone loss created an area of infection. And this is where all that infection proliferated. And this is an area of concern. Why? Because it is too close to the nerve here. So if we let this be here, it can end up damaging the nerve. So it's very important. This tooth here, we need to extract it. We cannot really save this tooth. This is a wisdom tooth. It's too far broken, too much bone loss, and the abscess is too large. And the tooth has big mobility. The tooth next to it, we can see on this panoramic, also has bone loss. You can see this V-shaped area that shows us the bone loss. And also I see a small abscess on this tooth. And in between the two roots, you see also bone loss. That's a cause for concern as well. Because once we lose bone between the two roots of a molar, it's very hard to keep that area clean. We proceed to this area here. We have a lot of wear on the teeth. You can see that it's like a car went on top of them. That is also because by missing these 2 teeth here, this patient is putting a lot of forces on these teeth here, these anteriors and these premolars here. So he has grinding problems as well, plus all the forces of mastication on such a short area make the wear even larger. And here we have some restorations. On this top area, also you can see on the right side, you can see 3 crowns that were joined together. I don't even know why they joined them together because it's very hard to clean in between these teeth. He already has a problem with hygiene. So imagine having these areas joined together. For example, joined together means you cannot floss through these. So also I see bone loss in between these. And we're gonna see in another x-ray the big problem on this tooth here. So also on the top area, you can see all the wear from the grinding. You can see here all the edges are like this. So we also have to fix that because that will continue. And with time, the teeth on the top are going to be very, very short. So let's see the other x-rays. Okay. So as I was saying, on the top right, that area of the 3 crowns that are joined together, which I really don't like that. Look, here we can see a little dark and dark. That means bone loss. And look what happened on this tooth here. You see dark here. This is decay, and it seems like this crown was never finished where it should have finished. So it creates an area that the tooth gets decayed, and this will have to be extracted. All this dark area here is bone loss. And because of not being able to clean this area here, look how all the bone loss also passed to the other tooth. So this tooth is also shaking. It doesn't have much support. Dark areas means there's nothing. Like for example, this is nothing, and this is the bone. But this, because of this harvesting of bacteria in this area, destroy the root here and also destroy the bone in this area here. So this tooth has a poor prognosis as well. This tooth we're going to have to cut here and extract it. We have to have ways here. In this case, we're going to add a bone graft, membrane, collagen, and we're going to put an implant here. And these two crowns, so we're going to section, remove them, and clean all these roots, and we're going to create two new crowns here. And this we're going to observe to see if we can restore it. We'll have to do a root canal and a post and a crown. But we're going to try to save this tooth here. Why we would not do a bridge from here to here after extraction of this tooth? Because the prognosis of this tooth is not good. So you will never put a bridge when your support is not good at all. Okay, so we're going to proceed to, here you have another view, better view of that tooth that's under those three crowns joined together. Look at all the decay that ate away that root. That root is all decayed, it's rotten, and it's taking care of removing the bone, also supporting that. Okay, so we are going to proceed to the one on the bottom left that we were talking about. This was the area on the panoramic that we saw the abscess. You can see a little darkening area here. You can see the break on that tooth on top of the nerve. And you can see how we have a dark area here and all the bone loss that's being lost in this tooth next to it because of the gum disease as well. So we're going to try to save this tooth, but this has to be extracted as soon as possible. Because, like I said before, the close proximity to the nerve. That's the nerve that supplies all that left side and half of the tongue. So it's very, very important to not let this infection continue to spread. Let's continue. And here on the bottom teeth, these are the lower anterior teeth. It's a periapical view. Here you can see the bone loss. From here to here is root. That part has to be covered by bone, has to be embedded in bone. In this case, we have a 50% bone loss, so 50% bone support. Why? Because of gum disease. You can see here, I don't know if it's clear on the video, some spiked areas. This is a two-dimensional picture, so we only see 2 dimensions. But that tartar that I can see radiographically, it goes all around. So that is making the patient lose the bone because there's more destruction, bleeding, inflammation. So you lose the bone. And this is what's happening, the result. So we have to prevent any further loss of bone. How do we do that? We have to periodontically treat this patient. We're going to have to do a scaling and root planing, which is a deep cleaning, and the 4 quadrants. Put the patient on a 3-month maintenance regimen of cleanings, good oral hygiene, some home complements, treatments for the patient to do, flossing. Very important to floss because we have to avoid that the tartar solidifies so much that destroys all the tissues. And also look at the grinding that I was explaining before. So we have to fix that, and we have to put a patient on a night guard as well to prevent any further loss of tooth structure. And also the patient told me that with time, his front, these are the two upper front teeth, that his teeth were spreading. Why are they spreading? Because of the bone loss. So when you don't have support of the bone, you start losing, the teeth are going to start spreading. And this is what happened with the two top front teeth. So again, once we restore the hygiene, we improve the periodontal condition and everything, we can start thinking about more cosmetic ways to improve his smile. So until we're not 100% healthy, I would never start putting crowns to improve the smile. We have to work on a healthy environment. Okay, so let's see what else we can see on these x-rays. Oh, we're gonna go to the bite wings, and just to complement a little bit what we were saying before, this is the left area. Again, that break, you can have another angle of view here, and you can see all the tartar and also the bone loss on the top areas. Also, very importantly, we have to replace those missing teeth so that he can have better biting, better occlusion. You can also see that tartar on this x-ray here. You can see here the spikes. Remember, this is a two-dimensional picture and it goes all around. What, for example, if all the tartar he has here, you cannot see directly on the x-ray, but I can guarantee you it is there. And remember, these are the three crowns that were joined together, and I can work and save these two ones. Again, we have to work on the gums, on the bone, but we can save them, replace them to new ones. These are porcelain metal crowns. I don't work with metal crowns. I only work with all ceramic crowns, and I think they're more compatible, they're better. So that's what we're gonna do. One single crown, and remember here we're going to put an implant because we cannot bridge from here to here when the state of that tooth is not good at all. So this patient is on his way to recovery. It's very important to diagnose everything. Very important to stop the bone loss. Very important, because if you let this proceed, what's going to happen? The bone loss is going to be so big, so large, that the teeth are going to start coming out by themselves. And they're going to have abscesses everywhere, because when you don't have the bone support, the bacteria will enter through the gum and infect it, and then you just need to take them out and go to dentures, or basically it will be dentures, because if it's such an unhealthy environment, I wouldn't recommend any other thing. Because if a patient doesn't take care of his mouth and you just take out the teeth and put those 4 implants, top and bottom, with screw retained dentures, you still need to maintain that. So why are you going to invest something that you're not going to maintain? So always maintain your teeth, your oral environment here. So I'm going to be sharing other cases so that to teach you, because I think by teaching people and so that people can learn what's going on, it's a better way of taking care of your own teeth, your own gums, your bone, and everything that goes with our smiles. So thank you very much for watching the video, and don't forget to subscribe to our channel. I'm going to keep adding more and more cases, because for me, knowing what goes on is the most important thing. Most patients don't even understand what's happening in their mouth because someone didn't tell them. And I think this is the most important fact to start learning about your health. Know how things happen or why things happen. So thank you so much for watching, and that's all for today. Thank you.